Hi and welcome to Doctors. So, clinician and a healthcare entrepreneur. How did that shift happen?
So I would not call it as a shift. I would say that it's an amalgamation of both the fields rather.
What is your healthcare startup all about? How do you help the doctors deliver this evidence-based treatment plan?
What we wanted to do was not give any kind of a replacement or restructuring to the healthcare system, but rather augmenting the practice that the doctors have been doing already, and how the decisions, the millions of decisions that the doctors take all around the globe, can be made easy, simpler, actionable, and with the help of evidence backing each decision, is something that we want to bring about with the help of whatever we are trying to build at Augsidius.
So, this is an AI-driven model.
Yes.
There is so much of buzz going around AI, right? How is Augsidius different from other AI tools?
So why we have decided to build Augsidius, the health intelligence platform that we have built, is we wanted to do something specific in terms of knowledge dissemination exclusively for the doctor fraternity. Now the difference
is Astra only for the medical fraternity, or can it also be used by the dental fraternity and other allied sciences?
So it is basically for providers first. So this can be used, Astra can be used by medical students and medical practitioners, not just in just medical domain themselves, dental practitioners and allied practitioners as well.
Hi and welcome to Doctors. Today we have a very special guest who is not only a clinician herself but also a healthcare entrepreneur trying to bring a change in the way medicine is practiced. Hi Dr. Akhila, welcome to Doctors.
Thank you for having me here today.
So, clinician and a healthcare entrepreneur. How did that shift happen?
So I would not call it as a shift. I would say that it's an amalgamation of both the fields rather.
Okay.
I'm still a practicing physician. I have my practice in a clinic.
Correct.
I just gave a break from my hospital practice so that I can have my new journey taken up as well, which is the Augsidius. The company where I am currently working as a advocate of evidence-based medical practice.
Correct.
It's rather an observation that I had over a period of time. As doctors, we have a lot of opportunity to look at a lot of gaps in the healthcare ecosystem.
Correct.
The people who are having the best visibility of those is us doctors.
Yes.
So I think that observation of the gaps in the healthcare ecosystem and how this entire journey has become very difficult for doctors to navigate. How can we make it easier for the doctors, and how can we save their time, was the question I tried to solve, and together with like-minded partners we have started Augsidius.
Okay. So, what is your healthcare startup all about? How do you help the doctors deliver this evidence-based treatment plans?
Yeah, so the startup's name is Augsidius.
Okay.
It is a bit difficult to pronounce.
Correct.
But it stands for Augmented Clinical Decision Support System. So it has a meaning around why we named our company so.
Correct.
What we wanted to do was not give any kind of a replacement or restructuring to the healthcare system, but rather augmenting the practice that the doctors have been doing already, and how the decisions, the millions of decisions that the doctors take all around the globe, can be made easy, simpler, actionable, and with the help of evidence backing each decision, is something that we want to bring about with the help of whatever we are trying to build at Augsidius. And that's how we started this company. So we make AI technology in a way that can simplify the evidence-based practice for the doctors. That's what we do in simple terms.
Okay. So, I believe this is a very helpful tool for clinicians. Because when
hope
you
so.
see doctors, there are people who are into research and there are people who are into clinical practice.
Yes.
So you are trying to combine both the worlds and
Yeah, that's absolutely what we are trying to do. So
yes,
we have doctors who are completely academic oriented, and
correct,
only in the time when they want to progress further in their journey is, there is something beyond happening.
correct.
And this is the special case, particularly in India. We are not very research focused here, apart
Absolutely,
from,
yes.
a group of people rather. And in clinical practice, we are first in the world in terms of population,
Correct.
and we have huge demand of healthcare services.
Correct.
And when it comes to doctors, doctors are always stretched beyond their capability
Yes.
on their time, the resources, infrastructure, whatever it is. So this is a broken, structure.
Correct.
There's a lot of fragmentation,
Yes.
because of which doctors usually in the clinical practice have less of inclination towards research, or they do not find the time, even if they want to further the research or understand and keep themselves updated on the best practices that are happening all over the globe. So we wanted to bring about a fusion of both these worlds. And to do that, we wanted to make it a simpler solution. uh, all along we have seen that technology has been adding to the burden of the doctors rather than simplifying it. It happened, this has come up in my discussions with a lot of doctors themselves, who are finding it difficult. When we approach them with a new technology, they would say that, "Nahi, I can't type. Don't add burden to me. I want to talk to my patient. Facilitate that for me," is what doctors usually keep asking. So they have bitter experiences. We all had bitter experiences. So we wanted to do something in a simplified way for the doctors. And that's where we leverage the best of technology for arriving at that.
Correct. So this is a AI driven model.
Yes.
There is so much of buzz going around AI, right? How is Augsidius different from other AI tools, or like there's Chat GPT, the most common ones which are available, which we all know. So how is your Augsidius different from it?
Yeah, so to explain that, I will first explain what is artificial intelligence. What technology does is it helps in scaling of something with the huge amount of computing power it has, right? So what ChatGPT, Gemini, and these kind of systems have done is they have built an intelligence which is called as artificial general intelligence. These are models which can predict the next word when we are inputting something into the system. And how is it arriving at the next word? It is because it is trained on huge amounts of data that is available all over the internet. What these models do is they go and search the entire internet from the data that it is fed, and from there it will give the prediction of the next word that we are coming at. What AI is trying to do is it is simplifying in terms of the communication. Now, no student writes their leave letter on their own. They just use these tools that are available out there. And even if, for example, we as doctors have to do a lot of marketing and other what do you say, the to attract the patients, to be visible in the market, we do have to do a lot of these things. But we might not be aware of how to approach that. We might not be able to generate good scripts and everything. So there is still a lot of advantage by using the tools like ChatGPT and Gemini, which can help curate all this information, content for you. You just ask it to deliver some script, and then it can give you a script entirely, which you can just plug and use it as it is. So this is all information, right? So why we have decided to build Augsidius, the health intelligence platform that we have built, is we wanted to do something specific in terms of knowledge dissemination exclusively for the doctor fraternity. Now the difference is there is the difference between information processing and knowledge processing. So when the information is processed in such a way that it can help make decisions easier and possible in a structured fashion, that is where the knowledge comes in, which is coming with the lot of literature that that's out there in the medicine. We have trained our AI model on medical literature, so it brings in the reliability and validated information. So what we wanted to do was give something reliable to the doctors, not something that can be picked up from the internet and can be utilized.
Yes.
Internet information might be useful for patients, for general public, but not for doctors.
Yes.
We doctors have to rely on either the medical textbooks or the research that is being published out there. So we have started off by building a health intelligence platform using the logic, the complex medical logic converted into machine understandable language. That's how our AI was born. Once this the AI layer is built in, we have got the validations and the quality and layers that are built on top of that. From there, we have come up with two different products. One is Astra or Astra, and the other is Clinistra. So these products are introduced into the market so that they can act as a assisting tools for doctors alone, not for the general public.
Correct.
So that is how we are different from the market available AI products.
Okay. So what is Clinistra? Astra is this evidence-based AI model, right? Which will help the doctors.
No, Astra or Astra is
But
basically
I love the word Astra. It is, it's like a tool in
Yes,
Sanskrit,
it is
right?
supposed to be the ammunition for the doctors to help them practice their medicine much easier and in a more better way. And the name was also coined to bring in that meaning so that it can act as an assistant to the doctors. So like Iron Man has Jarvis as an assistant, which does a lot of processing, of entire information and helps in the journey. And that's how we wanted Astra to be for the doctors. Yes. So this is a individual doctor's personal application which can be, which is just a mobile application that doctors can use. Like how you talk to Siri in iPhone, you can keep talking to Astra and then you can ask a lot of questions about your practice. You're confused about a dosage for a pediatric patient, so you can just ask and it will fetch the data along with the dosage and everything, recommendations. You have you're a little confused, let's say, about there is a pregnant patient that has come to you, and you need to prescribe them some medicines, but little unsure about the dosage or whether there might be any interactions or harm for the child. So every drug comes with a lot of drug labels, which no doctor can remember, right? So in all these situations, you can just ask and then you will get the information. That's how Astra is positioned today to help the doctors in their day-to-day search and decision-making process.
Clinistra.
Yeah, so Clinistra is basically a little more than what Astra can do. So Clinistra is an application for an enterprise. Now you as a doctor are benefiting from Astra by giving the recommendations on your day-to-day practice, and it is giving you a clinical pathway on suggesting you what is the next best action you can take according to the patient profile that you have given to it, right? But now you have a clinic of your own, and then you have regular patients who keep coming to you, and your time is consumed in interacting with the patient and making sure that they are getting the best possible treatment. Now we give you Clinistra, so that this can do a lot of automations for your clinic practice. So with the limited amount of staff that you have in your clinic, you will be able to have an assistant for yourself for your front desk operator, for your patients, so that the entire patient journey is managed with the help of Clinistra by having all these assistants everywhere. That from the time patient even thinks of coming to your clinic, and during the consultation and after the consultation, in nudging the patient in better adherence to the treatment and everything, at every step Clinistra supports by giving the assistance. That's
Okay,
what
so
it is.
it is basically a AI driven patient management
Wonderfully said.
software, correct?
Yes.
Okay. So you're not only empowering the doctors, but you're also empowering the staff.
Yes. I mean, if you are running a successful clinic, you would
Correct.
definitely agree with me that once you have a staff, a front desk operator, let's say, and you have trained them, they were worked with you for a couple of years, and now they left. There is a new person who is coming in. Isn't it a challenge
It
to?
is, I think it's a nightmare
Yes.
for clinicians.
Correct.
Yes.
So this particular problem is something that we wish to solve by giving an assistant for the operations for a front desk operator also, so that this entire transition becomes easier for a
Easier.
clinic, and this transition period is not a bitter experience for the patient, neither the doctor.
Correct.
And that is what we help with the help of the tool that we have designed.
So you work closely with the doctors, and because everybody has their own working style, the way I deal with my patients, the way I train my staff is completely different from somebody else. Their work. So does Clinistra, is it tailor made for every practice?
Absolutely. So it understands the working style that you have. It will create the entire application comes with a persona that can match how you practice.
Okay.
And according to that, there are different specializations can be having a different personas, and it can adapt to it. It just takes some time to understand your practice, observe, and then learn. That is where AI is currently the era that we are in, right?
Correct.
A human also can observe and learn, but AI can do it much quicker
and
at a
faster.
great. Yes. So that is what we are able to do it with the help of Clinistra today.
Wonderful. So, okay. So coming to your personal journey, how did the transition? How was the transition from a clinician to a healthcare, entrepreneur? How was the transition? Did you face any initial difficulties?
So I would say yes and no. So it has been a good experience.
Is it?
I definitely have my share of challenges as well, because we as doctors were never trained about how to manage a business,
Absolutely.
anything about the financial aspects, or technology itself was new.
New.
So how to establish something, how to the entire journey of a startup was totally new for us.
Correct.
Not just me, but for my co-founders as well.
Okay.
I would say that we are still learning. So we are trying to learn, but this learning is much quicker. We are learning something, and we are grasping something even as we speak. Today there is a new learning coming our way. So
Correct.
this transition has been a great experience rather, because the entire journey of responsibility, not just on building something, but when you are in the role of an entrepreneur, you are also an example, setting for the next generation to come in. So this is the biggest challenge. One wrong step, you are giving a wrong example to the whole ecosystem. So taking everything with caution, measuring every step, and seeking help was the best learning that we have had so far. Never hesitate to seek help.
Yes.
So that's how my entire journey has been. It's 2 years now since we formed Augsidius. And I would say that if I am starting a new company today, I would definitely have a better clarity than what it was 2 years before.
2 years back.
Yes.
So, how do you juggle between being a I mean, how do you spend time? I mean, how do you allocate your time between your clinical practice and your? I'm sure your startup would demand a lot of time, right?
Yes, yes, it does. So now, since almost 6 to 8 months, majority of my time goes into my startup only, and my the patient care has taken a sideline as
Vaccine.
of today. But I would say that all the initial foundation of the learning has come from the line of patient management and patient care
Yes.
only. That has been the foundation for me all along. Because today, when I'm building a startup and I'm trying to help doctors and building this use case, I know exactly the pain points that the doctor goes through,
Correct. Yes.
and not just doctors, but what are the expectations of the patients, and how we can better build a product, how we can make the whole interface easier for doctors to
Doctors,
use.
yes.
Where would this fit in the
Because I think
workflow?
most of the doctors are technologically challenged. We are not very tech savvy people. So, how do you face a resistance like that? Because if tomorrow there are all these seasoned practitioners and who have been doing things their own way, do you face a challenge in the doctor community to penetrate the market?
So, to be very frank, yes, there is resistance also. But then the resistance is not because the doctors are technologically challenged, I would say. It's because they have been given tough technology. Their experience was difficult with dealing with all technology. We see a lot of hospital information management systems, and we
Yes.
see a lot of electronic medical records. Today, they are just conversion of a paper record to a digital record. You will
Yes.
have so many fields to be filled in. Where does a doctor get time to actually talk to the patient face to face like we're doing
Yes.
right now? That is minimized, and a lot of computer facing work has been increased for the doctors. That, I think, is the biggest reason why doctors are a little resistant towards adapting to any new technology. But I think one good advantage I believe we have is that we are doctors. Myself and my co-founder also being a doctor, we can speak the language doctors can understand.
Correct.
We can help help them experience how this can fit in into their workflow, how it can make things easier for
Easier for
them.
them.
That has been a little saving grace for us, I would
I
say.
think that is an advantage because like you rightly said, you understand the pain points of both, the doctors and the patients, so you can help build something, help
Yes, yes.
the bridge.
Absolutely. But
Yes.
it is a myth that everyone would say that I think young doctors pick up your solution very easily
Hmm.
and resonate with you. There are people who questioned us saying that are you able to bring in any expert doctors with more than 25, 30 years experience? My answer to them is yes, we have doctors in very experienced also who are working as research partners with us,
Okay.
helping us advance our intelligence much more better way. And they are, although not very friendly with the technology, are helping our solution being adopted and become resilient as well. It is just the mindset that we have. Every doctor wants to do better,
Better for the
deliver better
patients. Yes,
for
yes,
their
yes.
patients. And most important thing that doctors usually resonate with is what is it that I can do? I can improve the impact of my time
Correct.
towards my patient.
Patient.
And this is the particular problem that we are able to solve, because of which I think the adoption is better.
Better. So, Dr. Akhila, nowadays we have a lot of younger generation who wants to get into innovation and do something beyond the medical field. So, what message do you have for them? For you, as a clinician, as somebody from the medical field, getting into tech, how was it? How was your journey?
So, two parts of this question basically. The first part is something that I'll cover later on.
Yes.
The second part, as a doctor myself, starting something in the technical field, this is a question I keep getting. Even for that matter, when we are talking in a forum, and I, as a doctor, I'm talking about building AI technology.
Correct.
There are a lot of eyes that we attract. So I think it comes from observing the problem very, very close.
Yeah.
We have seen the gaps so close with the complete fragmented ecosystem that we have in the healthcare. Even though doctors do their best possible, the ultimate care delivered and the outcomes are not improving because of too much of fragmentation. This is a distress that I have faced during my entire 14-15 years of journey as a medical practitioner myself. And I've also had an opportunity to work with a lot of community health associations as a part of my the Telemedicine Society of India that I am a member of and a secretary of. We do deal with a lot of last mile health programs, the underserved areas, the remote locations. I've worked with telemedicine for almost 8 years during my entire career.
Okay.
So I've seen the doctors putting their best effort, but the ultimate care that was delivered was not reaching every nook and corner of the country, and there was a gap everywhere. That actually brought me to study the data much more, and that is why I have learned data science myself. And I wanted to speak the language that technologists speak, so that we can have a free communication. And ultimately, when we have studied the data, we have seen a lot of outcomes that were not, first of all, measured in a very good manner. We give a treatment to a patient until the patient comes back to us, because patient usually goes from one clinic to another.
Yes.
And there is a lot of window shopping
Window
that
shopping
happens
that
as well.
happens, yes.
So we are not able to measure the outcomes of the patient.
Absolutely.
And because of which, what happened is the entire focus of the entire medical fraternity has become towards treating the condition, a transactional care, more than a longitudinal care.
Correct.
For the patient. So these were the very problems that we wanted to solve. I would not say that I have built technology myself. We have a team for that. We have a very good technology team, AI engineers who are working with us. My co-founders, coming from technology background and business background themselves, have resonated with the problem, and together we came up with this solution where we want to drive the entire focus of the healthcare ecosystem towards outcome. That is what we are now calling it as FOMO, focus on medical outcomes. And this is what we want to drive, as an organization. So tech is something that needs to be understood by doctors, not necessarily be built by the doctors. So there was a medical college that we were speaking to the other day, where they were teaching Python code to medical students. Imagine how difficult their life must have been. So it is not necessary that if you have to think about something doing something in technology, you need to learn coding, or you need to build technology yourself, build stethoscopes or devices yourself. But giving this information in an understandable way to the technologists, and together, taking part in this journey from the beginning, rather than once everything is made, using it and then taking a decision whether I want to use this or not. That is not where a doctor should be. They have to be in the journey from the beginning, and this is what we are trying to promote as well. And now, towards your first question that you have asked about younger generation who are thinking about doing something
innovation, yes.
So for them, my my take would be, if they have observed some problem, they are halfway through being an innovator. Observing the problem and really feeling the necessity of that being to be solved is the first and most important thing, irrespective of whether you are a doctor, you are an engineer, you are a entrepreneur or anything. That being said, as doctors, even if we are going for one rounds to the to throughout the entire hospital, our daily rounds, we observe a lot of problems there. If you are feeling that there is some pain point that is not allowing you to deliver the best of your service, you have found your problem.
Yes.
So now the doctors just need to think that who can I network with so that I can solve this problem better.
Yes.
And that is where we are again trying to associate with a lot of enablers of startup ecosystems. We are trying to create this awareness among the unfortunate doctor community who are not usually taught anything about beyond their medicine. We are working with all of them now to start the at least trigger that thought process in the medical students that they can do much beyond. They can deliver not just better patient care, but they can probably work with another tech company. They can find a better problem that they want to solve in their free time, and how they can do that, how they can navigate this entire journey is what we try to help them with as well.
Wonderful. So apart from Augsidius, is there anything else that you're passionate about or you're currently working on?
So I would say that we are trying to bring in all our passion together and then solve through Augsidius as of now.
Okay.
So my time apart from building Augsidius is going towards further promoting evidence-based medicine. So it's part and parcel of what we do at Augsidius. We do a lot of workshops with medical colleges, with business schools, with some engineering colleges, in giving them the biomedical engineering segment, basically giving them the use cases or the direct experience of medical fraternity so that they can understand that and build their solutions. So that's where a little of our time goes into. And also because I am a member of the Telemedicine Society of India, we have a state chapter, Telangana state chapter, and I'm a secretary for that. So my time also goes into consulting with different organizations in helping them adapt to the telemedicine practices. If they want to start something, what are the ethical requirements of that, what are the standard regulations that they need to navigate, the infrastructure, and these kind of support that we provide for them.
Great. Another question. Is Astra only for the medical fraternity, or can it also be used by the dental fraternity and other allied sciences?
So it is basically for providers first. So this can be used, Astra can be used by medical students and medical practitioners, not just in just medical domain themselves, dental practitioners and allied practitioners as well. So when it comes to understanding the disease and evaluating how the disease is progressing and all, I think every field of medicine follows a similar approach.
Correct.
So that approach is something we can help with Astra, and also bringing up the research that is published all over the world in around a particular disease is something that we can help with through Astra. But when it comes to the management, Ayurveda, Homeo, the Unani, these other allied branches have different management methodologies. Their drugs are different, the treatment approaches are different. That is something that we have not yet reached. Probably in the future we will also expand to that. But for today, it is limited to the medical and dental practices. In the management.
So it is limited to allopathy, we should.
Allopathy, yes.
Where do you see Augsidius in the next 5 years or 10 years? How do you see it influencing the healthcare system in India?
Our ambitious goal is to see Augsidius being the forefront of powering every health technologies out there with the clinical intelligence that we have built in. But to reach there, it would take a lot of time and effort. We would wish that it would happen. But at least the immediate goal where we see is for Astra to be in the hands of every practitioner, specially focused on the medical students and medical colleges. That is where we are beginning with, and we have good number of users using the solution and feedback coming in as well. And with Clinistra particularly, it is the doctors or clinics rather who are more inclined towards longitudinal care of their patients. These are the ones who are adopting Clinistra much more quicker than the other clinics and facilities. What we wish to build in 5 years is actually a marketplace where built by Augsidius. It's a horizontal layer across Astra and Clinistra both, where every doctor can create their own care plans, their own AI agents or AI models in forwarding, in promoting their personal practice. And for that, building in intelligence as a persona of the doctor is something that we are trying to do. And it has to reach to a certain extent where it becomes a marketplace where every doctor can, just using the natural language, using our platform, can build AI models and AI agents. And this can be used as a means to share their knowledge with the younger generation, with their peers. Something that today we are doing with the help of research publications.
Yes.
A few of them are publishing papers and sharing their knowledge,
Yes.
their best practices, what worked out for their patients, right? This is what we wish to do with the help of our AI solutions, that every doctor should be able to share their best practices. And ultimately, driving the entire focus and attention of everyone towards sharing the right knowledge in the right ways possible.
Correct. So we have spoken so much about technology, right? But medicine as a field is very human centric and very personal. So how do you make sure that this is not technologically driven and still human centered and maintains that personal touch?
That's really a wonderful question. So I would answer it this way, taking a terminology from the technology world itself, that the system is having human in the loop. So the concept is basically like this. AI is artificial intelligence,
Yes.
right? It can do a lot of things on its own without even we intervening.
Yes.
That is the whole direction that the technology is towards going. You might be hearing about AI agents.
AI replacing the human.
Replacing the human, AI agents.
Yes.
So what it does is there is some autonomy that's given to the AI to take decisions, to do some actions. It's like you build an AI agent that will go search the internet and book a flight ticket for you. You just have to give them the time and the required details.
Yes.
So this is something which has a lot of autonomy on its own to do something. But when it comes to healthcare, it is very, very important that there is a doctor making decisions.
Correct.
That is the whole advocacy of evidence-based practice that we are doing as well. So evidence-based practice is nothing but bringing a harmony between what patient believes in, what is the scientific evidence that is being generated from way back, what is the advancements, what has happened, and how it can create a differentiation, the expertise. And third is the doctor's own experience. Yes. That they have, what they have seen the patients respond to, what is the expertise that they bring into the table because of all the past experiences. Bringing in a fusion between these three factors is what evidence-based medicine is all about. And how we are trying to do this is we do processing of all the information coming in from the scientific evidences that we have spoken to you about, also understanding the way you practice medicine, also understanding the patient's profile that is generated. So we do the entire analysis in the back end and we give you the insights. Now there is no decision that is made that so and so medicine of so and so dosage has to be given to the patient at so and so time, and these are the observations, these are the side effects that they might have. This is the time that they might be they might have to come back for a review or something. These are all the decisions that a doctor is taking.
Okay.
We give them information in a processed and structured manner so that they can refer to as in, you imagine it as a second brain that you have, which is doing all the processing and making it easier for you and ultimately helping you make the decision. So there is no decision that either Astra or Clinistra is making on its own, but rather facilitating all these things to a doctor
to make better choices and better
yes
decisions.
So that point of decision making being in the hands of the doctors themselves is called the human in the loop architecture. So that is how we are differentiating ourselves and making sure that the safety of the patients is of prime importance,
Yes.
not beyond any hype that is created all over the world.
Absolutely, because these days we see our patients Googling their symptoms before visiting the dental office or the medical practitioners. Patients are much more equipped with all the information around. So,
Yes.
I think this is very important to know where a doctor comes in and how they practice.
Correct.
Yes.
So, that is again a very important aspect that has been bothering us a lot.
That's a huge responsibility on you.
Correct.
Especially when you're developing something this huge.
Yes. So we have gotten questions like this also, that you are enabling so much of information processing.
Yes.
What if it falls in the wrong hands? So the answer to that is very simple. We believe, we as Augsidius, each member of Augsidius believe that the right information has to reach right people in the right time, in the right format. We are not an information dissemination company. So there is already too much of information overload.
Yes.
And a classic example of that I would like to share, which we were discussing earlier, was a patient who had a 70-year-old patient who had gotten mammogram done a year back, but the mammogram showed that the report was quite okay. Nothing alarming that has come out in that. Why she got a mammogram was because she has felt, abnormality in the breast, and that is when she had underwent this procedure. Now, it's a very important step that we keep educating the patients on, right? But the challenge is, if the this patient has not gone to a doctor with the report, and after a year, we see that she has developed stage 2 breast carcinoma. So unfortunately, even after investigation was done, and mammogram is not a cheap investigation also, right? After getting that done, because of too much of information that is available all around, patient has not consulted a doctor, taken a decision then herself that it might be okay, I don't have any symptoms, waited for one whole year and landed up in this complication. Now this is something that I don't think we might be able to control as a company ourselves. Or I always feel very sad when I'm not able to do anything as a doctor myself for this. And again, this comes in as a sad situation from the whole patient family themselves also, who are going through these kind of, and we keep seeing a lot of such Google patients, and who are coming in, fully prepared. There are patients who say that now I think I'm half doctor because I can treat my condition myself.
Exactly.
This is not a problem that probably I have an answer to, but the advocacy of sharing in limited amount of information only, and making sure that at least our products are not falling into the wrong hands, having all the safety netting as much as possible, is something that probably I have in my hand, or we are trying to bring in this awareness as doctors into the community also, right?
Yes.
This is the least that we can do to prevent
And
this.
I think for in a country like India, it is more challenging because even the drugs that we dispense, most of the drugs are also over the counter. They are available without a prescription.
Yes.
So
Yeah, half the time pharmacist prescribes the medicines
Exactly.
to everyone, right?
So, augmentin and azithromycin are used left, right, center, and
Absolutely. And when the patient ends up in an ICU, these medicines don't work.
Yes.
The patient ends up in a sepsis, and the high-end antibiotics are not working on him, unfortunately.
Yes.
It's because of these wrong practices. Everyone thinking they're doctors just because they have information is something that we have to change. At least what we can do is bringing in that awareness.
I think with this podcast, this is a very important message that we should convey to the people that
Don't take your health in your own hands.
in your own hands. Yes.
That's true. It is important. It might be a bitter experience with one doctor or so that the patients might be having also.
Yes.
But that doesn't mean that you have to go search for another doctor.
Yes.
You can go see the same doctor. They can observe what is the progress of the condition and then treat you also, right? That is also a possibility. So build that trust with your doctors. That is more important. That is what I would want to pass on as a message to the viewers of this podcast, that don't take health in your own hands. Doctors in this community are there to make better decisions for your healthcare. Please avail their services.
Yes. And I think we are also giving a message here to the doctors that apps like Astra and Clinistra are there to not replace you, but to make your lives easier and help you deliver better.
Absolutely. I mean, don't get threatened by too much of hype that is being created all over the world about AI replacing humans, a lot of jobs going away because of AI coming into the picture. Unless you understand what is the best possible outcome that AI can bringing into the system. At the end of the day, AI is just another technology, right? Like we are having this mic here, which is amplifying our voice. Similarly, there is AI, which is doing a lot of computation much easier for us. And it can only do what it is, to the extent that it is trained on. Nothing beyond that. And that capability is just lying with the doctors. So don't get threatened by the hype that is being created out there. And just try to use and just try to understand what the technology right there in front of you is able to do better, and evaluate it. Don't use it as it is also. Evaluate it. Like, before buying a phone, we do a lot of background search, which phone is the best, and what are the preferences that I have, and how can I make sure that it is the best value for the money. Same thing goes for any new technology as well.
Correct.
So just do that, and I think we will be able to build a better healthcare ecosystem. We can bring in a lot of improvement if we are working together on this.
Correct. So, if you could just share, sum this up and share one message that you would want to give to a fellow doctor who wants to make a larger impact, what would that be?
My message would be, apart from their own practice of patient care, I'm sure that every doctor wants to give the best possible results for their patients, and they want to scale up further. They want to do much more to the society. So I would request all the doctors to, take that step from just where you are. Don't wait for some kind of a persuasion coming in from behind, or don't wait for someone requesting you to take up a position like this. In considering what can we do beyond what we are able to do today in the patient care. Don't wait for any kind of stimulation from anywhere. So start where you are. I'm sure there will be a lot of questions. We have a lot of questions that are unanswered. We are searching for the answers ourselves. Once the journey begins, and you are taking that one step towards building a better healthcare system, and not just accepting the status quo of how things are, I think we will be able to do much more better than what we are able to do today. Especially because we are kind of accepting the whatever practices are happening around. We are okay with the wrong practices. We are
Correct.
okay with the gaps in the entire ecosystem. Let's not do that. Let us try to challenge that. We will be able to figure out better answers as doctors ourselves.
Very rightly said, and thank you so much. It was very insightful and very a lot of innovative, I think, discussion has happened, and you have enlightened doctors also on technology as well. Thank you so much for coming on, doctors.
Thank you very much. It has been really my pleasure to have this discussion, and I'm sure there would be a lot that we can do together eventually.
Absolutely, because we as doctors also are, we are a platform for doctors as well as for entrepreneurs. So we are trying to combine the best of both worlds and try to bring a change. So definitely,
That's a wonderful work that you're doing. I really appreciate the work.
Thank you,
And
thank you.
I would be, we as Augsidius would be very happy to, do something in a partnership with what doctors can do, and to bring in that empowerment of doctors and entrepreneurs that you're
Exactly.
doing. Would be very happy to take it further.
Wonderful. Thank you so much.
Thank you very much.